Hello everyone, this is Kendra Mickens. I am doing a PowerPoint presentation on Virginia Henderson and her need theory. And I have actually tried to make it larger, but that did not work. So I'm going to try it going one slide at a time, but not in full screen. I'm starting out with the abstract of just what this PowerPoint presentation will be covering, which is Virginia Henderson and her need theory. In review, we're going to be discussing her work as a nurse as well as her work as an educator, which are the two things that greatly molded her development of her need theory. And we're also going to discuss the contributions of her theory in research as well as nursing practice and education. A little bit about Virginia Henderson. She was actually born in 1897 in Kansas City, Missouri, but she was actually raised in Virginia. And reading and learning more about Virginia Henderson and her family, her father was actually a lawyer who worked with the Native Americans, and it appears that the family actually relocated to Virginia to be closer to Washington, D.C., since her father actually was defending the Indians against the U.S. government. So they needed to be closer to Washington, D.C. In 1921, you can see that Virginia Henderson started her nursing career. In 1918, she started her nursing education at the Army School of Nursing at the Walter Reed Hospital, of course, in Washington, D.C. And in researching, it says it just came out of a need from her wanting to help. When she was looking at the hospitals at that time, even the patients who were not just, even though there was a war going on, so not just the soldiers, but just patients who were in the regular hospitals, it was just not a good situation at that time. And just out of a need and a desire to want to help others, she decided to go into the field of nursing. And then in 1921, after earning her diploma, she actually started her nursing career at the Henry Street Visiting Nurse Service. After 2 years of working there, she actually then went into a nurse educator role at Norfolk Protestant Hospital. And then a little while after that, she actually decided to go back to school. And that came from, appears an intrinsic need that she felt that she needed more education. And so she decided to go get her bachelor's degree from the Teachers College at Columbia University. And then she continued her education and actually obtained her master's degree as well. Her actual relationship with Columbia University didn't end there. She actually then went on to be an educator at Columbia University for the next 14 years. In 1953, she actually became a research associate at Yale University School of Nursing. And then, unfortunately, but after a wonderful long life, Virginia Henderson then died at the age of 98 in March 19th, 1996. When we look at the different highlights from Henderson's career, she definitely helped create a nursing curriculum for the National League of Nursing. She also revised the fourth edition and then wrote the fifth edition of Harmer's Textbook of Nursing. She also is credited with directing the Nursing Studies Index Project, which is the first annotated index of nursing research. And as Dr. Colvin has pointed out, and it is outlined in our book as well, Sigma Theta Tau International Library is actually named after Virginia Henderson. In discussing her development of her theory, there are a couple interesting things about Virginia Henderson's theory. One of the things that stuck out was that she didn't focus just on when the patient was ill. As far as our role as a nurse, she also focused on the importance of us providing education for that patient and helping prepare them for when they can become independent after they leave the hospital. You can see that her theory actually came from both her nursing practice and her education. And because of that, her actual theory is described as being more of an inductive development of her looking back over not just her experience, but also her education to develop her theory on patient needs and the role of the nurse in assisting the patient to get back to optimal health. When we look at her definition of nursing, she actually labeled it as her concept. When we look at her physiologic principles in developing her theory, that is a part that she actually got when she was in her education for getting her graduate degree. And it was those principles that she learned as she was obtaining that graduate degree that she actually started molding and thinking, and it was actually the formation of some of the foundation that she had for her theory. And again, as pointed out, it was not just her education, but then also her time as an actual nurse in the field. And it is actually her visiting nurse time in New York City that is credited with helping shape her understanding of the promotion of the patient's independence and the need for the patient to be prepared for taking care of themselves after they leave the hospital. As well, Henderson also credited Thorndike for just looking at that influence that Thorndike had for her fundamental needs of man. And then when we look at the theory, it also defines the role as it relates to the patient who is ill, lacks strength, or the knowledge to care for themselves. When we look at the assumptions from Henderson's theory, she assumes that nurses care for the patient until the patient can care for themselves, that patients desire to return to health, nurses are willing to serve and devote themselves to patients, and nurses should be educated at the university level. When we look at what kind of molded and the concepts that came out of her theory. These 14 activities for client assistance are really the catalyst for how she feels nurses can help a patient move back towards independence. So looking at things like breathing normally, eating and drinking adequately, moving and maintaining desirable postures, even looking at sleep and rest. It goes on to talk about hygiene and then again avoiding dangers in the environment and avoiding injuring others. Also communication, worship according to one's faith, and then work in such a way that there is a sense of accomplishment. Play or participate in various forms of recreation, and then she also looked to have them use the available health facilities that would be available to them. When we look at her impact on research, she actually changed some of the focus for nursing research. Prior to Henderson, more of the research was looking at nursing education and not so much the work of the nurse and the implications that came out of the interventions that had been applied by nurses. So her coming on the scene actually changed that impact. And when you look at the 14 activities that can individually be used for the basis of research, they stand on their own as individually 14 different areas that anyone could use to research and see what impact that has on a patient. Her theory served as a framework to help confirm value of tested interventions. And again, a care dependency scale was created by an international team based on Henderson's concepts of nursing. When we look at an impact on nursing practice, 14 activities used to evaluate nursing care.